There are so many questions surrounding Tristyn's murder that I, as a parent, can tell you it is difficult to know where to begin. But this morning, our goal is to get the answers to questions you moms and dads may have as a result of this story that has broken our hearts. As our children asking, how could this happen? And how do we answer our children's questions? Joining me on the morning show is Dr. Dan Weinberg, a psychiatrist who actually lives in that Durban community and whose own child is asking the very questions that I mentioned. Good morning, sir.
Good morning.
Definitely not convicting the 14-year-old in custody who is charged with Tristyn's murder here because he is entitled to a fair trial. In a broader sense, let me ask you about one teen murdering another. What might lead to that?
Teen-on-teen violence is not very common in this age group, especially in a community like the one that we live in. I don't want to speculate on the cause, as you mentioned, but some things that can be related to violence in teens are drugs, as well as underlying mental illness. When you get outside of that, then there is an element of criminal sociopathy that starts to emerge at this age. We can see things similar to what you would see in the adult population, such as lack of remorse and no feelings of guilt.
I know a parent who happens to be one of your neighbors who has two young children, and her son is asking, Mommy, it wasn't an adult who they think murdered Tristyn? It was another kid? How do you answer that?
You answer it honestly, which is, at this point in time, we don't know what happened, we don't know why it happened, but a young woman has passed on and has moved on to heaven, and that there is a person who is in custody, who is also goes to that school, that is related to the incident. A lot of people have anxiety talking to their children about what has happened in the incident, and my wife and I had to tell our second grader as well. It's important to remember that as long as you are loving and caring, there is really no wrong way to talk to your child. You want to give them time, so different children react differently. For instance, when we first told my eight-year-old, he went to his room, he started playing with his Legos, it didn't really register, and then he came out a short time later and said, am I safe? And we reassured him that 100% he was safe and that this incident was not going to go any further. With older people closer in age, it's going to hit them harder, especially if they're in the same classroom as the victim. And different dynamics are going to come into play if they knew both of the people involved and if they spent time with both of them. So it's important to give your younger teenagers time to process and not to push them. You want to show loving support and tell them that you're here to talk to them, but also give them the space that they need. In the coming weeks, we're going to see more and more emerge as to what happened, as well as more symptoms for people who are struggling with this. I encourage parents to watch their children's sleep habits and appetite. If your kid normally sleeps very well and they didn't sleep at all last night, right now, that's normal. In a week or two, that should start to level out a little bit. Same thing with appetite and energy level.
I want to show you a picture. It's of Aiden in the back of the sheriff's vehicle during the investigation. It popped up on social media. He texted, hey guys, has anybody, INBODY, seen Tristyn lately, and flashed the peace sign. He seems, I want to use the term cavalier. Does that picture tell you anything?
Well, it certainly says that he's not taking it seriously, I think, in the manner in which he posted it and sent it out there. We don't want to assume guilt and we don't know what happened, but I think that this is something emerging in our society where our young teenagers are fixated on social media and they are looking at everything as a way to kind of filter how they see the world. So I think this is an emerging problem in our society, and it's one that we're all struggling with because as parents, I didn't have that growing up.
So, Dr. Weinberg, I think the biggest takeaways from this discussion as a parent myself are that, number one, we've got to be patient with our children, we've got to listen to them, we've got to also give them space, and that this is something that's not going to go away overnight.
Correct. This is going to be a marathon, not a sprint, and it's going to affect the community for a long time to come. And one of the things that my wife and I did is we wanted to help people in our community process this and deal with their children. So certainly yesterday we went out to the amenity center and talked to parents who had questions. We don't want to talk online, but we are very, very willing to talk to people one-on-one in person, and we'd be happy to help guide that process and help them process their grief, as well as just end up saying at points in time, hey, this is normal. What your kid's going through is normal. It's okay.
It's also time for parents to listen to their children and not always talk. Dr. Weinberg, thank you so much.
You're welcome.